Hi everyone, my name is Peter Kellett and I'm an assistant professor in the faculty of health sciences at the University of Lethbridge. I'm a nursing professor, but I also study population health issues, and I have an expertise in the area of gender and health, and in particular masculinities and trans identities in health. Although certainly the reason I'm talking to you about this topic today is that you will find that many of the issues that nursing faces is highly influenced uh, by the concept of gender and the fact that caregiving has been placed rather firmly in the realm of the feminine in patriarchal society. So what I want to do today is sort of introduce you to the concept of gender a little bit, because I imagine that many of you haven't had any gender studies in the past. And I also want to sort of talk to you about the role that we all can play in trying to prevent some of these gendered scripts from affecting the direction of the profession and also our experience of the profession as nurses. Now, there are a number of learning goals that we're going to kind of cover in these following slides. However, I think that the key thing is that when we ask people about what some of the biggest issues in nursing are, they'll often talk about things like horizontal violence. They'll talk about issues like staffing mix ratios, RNs versus LPNs versus healthcare aides, issues of funding and pay, what resources are allocated, um, nursing education practices, and hierarchies in nursing education and practice settings. And all of these topics really intersect with gender. And so in order to sort of start talking about some of those issues, I want to sort of first get you into a discussion of the concept of gender. Now, I'd like you to think about these questions. How would you define gender? How do you know if someone is masculine or feminine? How do we label individuals that are not congruent with gender expectations? And just where do these expectations come from anyway? Now, if you're watching this video as part of a class, you could certainly, if you wish, pause the video at this point and just have a bit of a discussion about this. But if you're watching it by yourself, then just think about these questions. Certainly, when we get into the concept of gender, I'm going to talk about that one a little bit more. But whenever I ask the question, how do we know if someone is masculine or feminine, we tend to get people using very stereotypical statements about masculinity or femininity. So a man is usually described as tough, strong. Sometimes when we talk about masculinity, people talk about muscles. Sometimes they'll use terms related to leadership or things like that. With women, we tend to see a lot of terminology around caring, kindness, social interaction and support, and seeking out social support of other people and being more emotional and things like that. Again, these are stereotypical statements. They are not necessarily reality. And then when we think about how do we label individuals that are not congruent with gender, we know that certainly if men are not, their social performance is not consistent with how people feel men should be, they may be called a sissy. They may be called other names. They may be gay baited and implied that they're homosexual because they are more feminine in their presentation. We We'll also see women being labeled as being bitches because they're aggressive in people's minds. Whereas their aggression may not actually be aggression, it may just be assertion, which in men would be viewed as a beneficial thing. So we can see how labels get used to try and keep people inside certain boxes all the time. Certainly I do work with trans individuals as well, and certainly trans individuals get labeled as abnormal. They get labeled as being inconsistent with biology or the way the world should be, especially when religious perspectives are brought into that. Now, obviously, I don't feel any of those things myself, but we do see that language is used as a means of policing gender and policing what's masculine or feminine. So, and where do these expectations come from anyway? Well, I think that the big answer would be society in general. There are social norms that develop out of the social context in which we live. But I think we also have to keep in mind that although that there are definitely some local social contexts, there are larger forces at play. For example, patriarchal perspectives cross borders. They have been translated in a lot of different areas in the world. They are linked to belief systems, and so there are some patterns that tend to cross areas, although there are also some differences. So we're going to explore some of these things as we move forward. Now, when people learn about gender, a lot of times people bring up the idea of biology and biological essentialism. And certainly in the old days of looking at gender, there was a lot of emphasis on biology. And indeed, we as nurses are part of a biomedical worldview, which puts a lot of emphasis on biology. But I would like you to start thinking a bit beyond that. So under biological essentialism, the assumption would be that men are who they are because they have an X and a Y chromosome, and women are who they are because they have two X chromosomes, and that certain biological processes in male and female bodies, such as the amount of hormones, testosterone versus estrogen, are highly defining how people act. Like, people often associate testosterone with aggression, and they'll associate estrogen with gentleness and caring and these kind of things. Certainly, the greater physical size and strength on average that men have has influenced the roles men have taken in society, but it's also given them a certain relative power in terms of that. Certainly the fact that women can give birth to children, can breastfeed, has influenced some of the roles that they have been engaged in. However, we have to sort of ask ourselves, to what degree does biology determine who is male and who is female? And this is certainly the biological construct of male and female is true in terms of external sexual characteristics. However, there are also a lot of intersex individuals who may have ambiguous sexual characteristics, and not everybody fits neatly into this biological binary box that we like to use. A lot of people will suggest that human behavior is kind of an extension of animal behavior as well, and that, male and female animals act a certain way, and that way men and women act in society is an extension of that. However, that's a bit of an oversimplification of things. I also think that we have to consider evolution and the processes that take place in that. So if we constantly socialize boys to be aggressive and assertive and take leadership and those kind of things, and we socialize women to be caring and nurturing and things like that, then it's going to also influence some of our evolutionary development. And we also know that even when we look at functional MRIs of brains, while there may be some differences noted between males and females, some of these differences may be related to plastic changes in the brain related to certain stimulation and the way we raise people. Bottom line, if biological essentialism was the defining characteristic of masculinity and femininity, we would see masculinity and femininity being enacted in pretty much the same way all over the world, but we know that this is not the case. We know that that ethnographic studies that study different cultures show that there's a lot of variation between different areas. And even on a simple level, there are some cultures where men can be more emotional and it's not viewed as abnormal, whereas in a Western, European, British, German perspective, that may not be viewed as appropriate. And certainly those expectations are put on men in Canada and the US as well. So anyway, we'll move on. So when people ask me, is gender nature or nurture, or is it nature versus nurture, I would say it's nature and nurture. There is an influence of biology. Certainly it plays a part, a significant part, but I would argue, based on my study of gender and everything I know, that nurture is probably a much larger component. And I would even argue maybe even 80–90% of gender is probably social. So just viewing it purely from biology is a bit limited and can be problematic. Now, when we take a gender studies perspective, it's important to keep in mind that the term sex refers to biological sex. And so male and female is a sex assignment. And it's based on chromosomal assignment and external sexual characteristics. However, the term gender refers to an individual's understanding of what gender they identify with, and this is socially constructed. So someone may be born biologically female, for example, with 2 X chromosomes, yet may identify themselves as male. And that person would be called a transgender man, possibly. Okay, so where did this idea of dichotomy come from? Well, I think that human beings in general like 2 choices: right, wrong, black, white, male, female. But the idea that people are going to fit neatly into one of 2 categories is highly problematic, but it's also very socially pervasive. And these boxes are they're really illusionary for the most part, because nobody really fits neatly into these boxes. And it's certainly perpetuated by some pop culture discussions, such as the book Men Are From Mars, Women Are From Venus by Dr. John Gray. Now, the premise of this book is that men and women are so different that they might as well have come from different planets. Well, I can tell you that research shows that actually men and women are far more alike than they're different, and that this is just kind of perpetuating this essentialized idea that men and women are predefined and that there's nothing can be done to change it. Now, in the mid-20th century, there was a theory called sex role theory, which was an improvement on biological essentialism, but it still had its problems. Now, in sex role theory, it was an acknowledgement that male and female roles developed in response to social expectations that define appropriate behavior for men and women. Now, this was an improvement because it did acknowledge that the expectations of being a man and a woman were very much influenced by society and what society felt was appropriate. Where it was still problematic was they still tended to view it in a very essentialized way, saying, well, in this society, this is the way men are, and this is the way women are. Now, in the 1970s, a psychologist called Sandra Bem created a questionnaire called Bem's Sex Role Inventory, which basically proposes to identify the degree to which an individual adheres to a male or female role. And those that don't fit neatly in the box are often called androgynous. So it tells you how male or female you are. Now this is based on a lot of assumptions of what is male and female. And when we look at what BEM-SELC's role inventory says about male and female, we can see that men, according to BEM, engage in instrumental behaviors, including an achievement orientation, assertiveness, autonomy, decision-making ability, dominance, endurance, strength, and power. Where women are characterized by expressive and communal behaviors, including abasement, affiliation, deference, passivity, submissiveness, and succurrence. Now, succurrence means seeking out the social support of others, and abasement means basically making yourself smaller in relation to men and other people. So, I'm sure that as you listen to these qualities, the women are probably not particularly impressed with some of the things that have been assigned to them. And there's also an awful lot of assumptions that men are going to be very dominant and strong and leaders and all these sort of things. Now, in a society that's patriarchal, as a patriarchal perspective, certainly these things are probably not surprising to see. But here's the problem with it. It's assuming that in order to be an acceptable man, you have to align with these qualities. In order to be an acceptable woman, you have to align with these qualities. But I think that all of us would agree when we think about the way we feel in the world that these ideas of masculine and femininity don't fit perfectly for us. And this is why people all the time say things like, I'm a man, but I'm in touch with my feminine side, or women say I'm a woman, but I have some masculine qualities. And I would say that most strong, intelligent women tend to say things like that they have masculine qualities because they don't identify with this idea of being submissive and not having leadership orientations and strength, because they obviously do. So anyway, this is why this is a bit problematic. Current perspectives around gender is that gender is socially constructed and that it exists in social performance, interaction, and power relations. Now, the idea that gender exists in performance is not really that surprising if you think about it, because even back in the 1500s, Shakespeare in the play As You Like It wrote, "All the world's a stage and men and women merely players." There was acknowledgement that daily interaction is theater, and that how we know someone's male or female is how they act, how they dress, costuming, what words they use, their scripts, these kind of things. Now, therefore, gender exists when you interact. It doesn't exist necessarily inherently in somebody in the same way, because it's only demonstrated through social performance. In fact, some gender theorists, more recent gender theorists, have sort of taken this a step further, like Judith Butler, for example, with a post-structuralist perspective that says gender is performative, in that when we give a social performance, our performance in and of itself leads to the social construction of what gender is in society. Now, this also exists in power relations, meaning that how men and women interact or how a trans person interacts is going to be influenced in terms of how they claim power in society. And so if in a patriarchal society men claim power, they may act as if they deserve power. They may act in a way that demands that they be treated as if they have power. Whereas if women have been socialized to make themselves smaller, as many women have, they may not interact in that way. And so it sets up a power imbalance and creates challenges. And inevitably, when power imbalances happen, the people who feel less on the hierarchy feel frustrated. But they may not always feel like they can assert themselves because they may feel oppressed in some form or other. So social context really matters. And certainly in my own studies of men in nursing, I've noticed that men change their performance of masculinity depending on who's around, what's the age and the sex of the patient that they're caring for, who's watching, all these kind of things. So context really does matter. Another thing to keep in mind is in society, masculinities and femininities are constructed in relation or opposition to one another. So how do we know someone's masculine? Well, they're not feminine. How do we know they're feminine? Well, they're not masculine. And we hear people making these kind of simplistic assumptions all the time. So another thing, gender is historically situated. Now, this doesn't just refer to historical time periods. And when I was first learning about gender and I read this idea, I thought, all right, that makes sense. Masculinity or femininity in a certain time period doesn't necessarily match masculinity and femininity in another time period. But as I gained a more complex understanding of this, I started realizing that when we talk about historically situated, we're just talking about time in general. So in other words, gender performance can change from minute to minute within the same person. And so the gender performance you may get from a person now may be very different than the performance 5 minutes from now, and this may be influenced by who's around them. And so because of that, there's not one single masculinity and there's not single femininity even within the same person. There are lots of different performances of masculinity or femininity or trans identity at any given point in time. Masculinity and femininity performances will also likely change as a person changes and as they go through different life course experiences. So certainly, using my own life as an example, how I enacted masculinity as a young man who was a teenager is a bit different than how I enact masculinity as an older man who's also a nurse, who's also a parent, who's been through different life experiences and who's studied gender. We know that as people age, sometimes they also get treated differently in terms of whether they are, meeting the expectations of masculinity or meeting the expectations of femininity that society tends to put on them. So I guess what I'm basically saying through all of these ideas is that gender performance is constantly being renovated and reconstructed, even within the same person. So, as I said, there are multiple masculinities and femininities. And if you doubt this, just think about a couple of things. So for the women listening to this presentation, think about men in your lives, whether that be your partner, your father, your brother, your male friends. Do they act the same when it's just you and them as they do when there are other people around or when there are other men around? And I would hazard a guess that there's a different performance. Another example would be, imagine a young guy who's hurt himself playing hockey and he's injured out on the ice. Would he perform masculinity the same to his coach or his teammates as he does to his mother or his girlfriend? Probably not. And we could use examples also in the case of women. Women are probably also adjusting how they're acting in different contexts. Now, the idea of gender existing power relations is really important to our discussion today. Because it certainly exists between men and women in society, but it also exists between men and other men, and also between women and other women. And people enact power on each other in lots of different ways in terms of trying to establish who's dominant, who's in charge, who is valued versus who is not valued. But it's also important as we think about gender to recognize that it also intersects with other influences on power relations. because we are not just our gender. So racism might intersect with this, wealth or social status, sexual orientation, and the list could go on. So, for example, where in patriarchal society, men may hold greater status than women in some contexts, some women who have advantages of wealth and not being racialized and being heterosexual, they might be assigned greater status than a woman who is a woman of color who's been racialized, or somebody who's poor or poorly educated. And so, we can see that there's a lot of different things influencing power, and power is a very key thing here. Now, I've mentioned patriarchy many times in the conversation already, but when I talk about patriarchy, I'm basically saying it's a social system in which males are the primary authority figures. It's central to social organization, occupying roles of political leadership, sometimes moral authority, control of property, and where fathers may hold authority over women and children in a family context. But it's been kind of extended to all contexts where male rule and privilege is institutionalized in society, and where women are subordinated in some way. Now, the patriarchal system is very entrenched in our society, and in a lot of societies, most societies, in fact. And we don't really, it's so common that we don't always think about what is happening and why things happen the way they do. And we can fail to realize its influence on us. It becomes a conceptual trap. But, if as a man you've had times where you felt like you didn't measure up as a man because you didn't display certain qualities of masculinity, or if as a woman you felt that somehow you had to hide who you were, that to be quiet, to not challenge people in order to demonstrate an acceptable performance of femininity, then you've been influenced by patriarchy. And although things have definitely improved in our society, I think that at a time where women are still making 75 cents on the dollar for men, we can see how institutional practices are still influencing the equality of men and women in society. And we also see a lot of discrimination and marginalization of people who are gender nonconforming, who don't fit neatly into the male and female categories, or who occupy trans identities. And we see even greater marginalization of some of these individuals. Now, in order to talk about how gender plays a role in this, I'm going to introduce the concept of hegemonic masculinities. And they're very key whether we're talking about power in the context of men or on the influence of power of women. Hegemony is a term that really refers to oppression, and was sort of brought forward by an Italian philosopher called Antonio Gramsci, and was picked up by a researcher called Raewyn Connell, who talked about the idea of hegemonic masculinities. Now, these are performances of masculinity that serve to perpetuate men's patriarchal dominance over women and maintaining men's privileged position in society. It often includes those performances of masculinity which are held in high esteem by society. We should consider it in the plural because there's not one hegemonic masculinity. What's hegemonic in one context may be different, not hegemonic in another. So an example of this might be, as a man working in academia, there may be a lot of things focused on intellectual achievement, number of publications you have, these kind of things. How many courses do you teach? Whereas if we're in another context, masculinity may be measured by how strong are you, how tough are you, how many fights have you been in, these kind of things. Now, obviously I'm using extreme examples, but different contexts result in different emphases in terms of what is hegemonic. Now, another thing that I want you to keep in mind about hegemonic masculinities is that they are mythopoetic. And what I mean by that is that no one could really live up to them. And if they thought about it, they wouldn't really want to, because they're not very positive. But because they're mythopoetic, it means that pretty much no men ever feel that they measure up. And this creates certain challenges for men and men's health. But we won't go into that right now. Now, these oppressive and dominating masculinities are not only directed towards women, but also men who are deemed to be performing subordinated masculinities in given context. So men who don't measure up, and I'm using that in quotation marks because obviously there's no such thing as not measuring up officially, but people may make those kind of statements. Now, because there are multiple masculinities, everybody's masculinity is different and is changing all the time, but there are collective patterns of masculinities within social groups. So when we ask a question like what does a man look like, we're often drawing on those collective patterns of what we deem masculinity looks like in our social context. And so it's why we think that there's some things that are similar between everybody. The question is, though, are those similarities biological or are they socially constructed? And I would say that most of it's social construction. Now, subordinate masculinities or marginalized masculinities refer to masculinities where people are viewed as performing a lesser form of masculinity. Now, sometimes this might refer to somebody who has a different sexual orientation. So someone who's gay or bisexual may be viewed as performing a subordinate masculinity in some people's eyes. Sometimes it may be related to income or education. It may be that, the classic geek who I was when I was in school is not measuring up in some way. It could be in all different situations. Now, in some contexts where, let's say, intelligence is hegemonic, it may be that they subordinate or marginalize men who haven't had a lot of academic achievement or a lot of success with education. Now, complicit masculinities refers to is when men don't actively engage in promoting hegemonic masculinities, but they also don't do anything to stop them either. Now, I think that most men don't get up in the morning and say, all right, let's oppress somebody today. And I think that we're often complicit by not speaking up about things. So when someone is making fun of somebody because they're not measuring up in some way, if we're not standing up and saying that's not appropriate, then we're contributing to hegemonic masculinity. If we hear somebody making a sexist comment and we don't say something, we're contributing to a complicit masculinity. We're complicit in perpetuating those structures. And so I encourage men who are listening to this to start challenging some of those things. There are also forms of masculinity which are very relevant for men's health and men's behavior in society, which are labeled in different ways by different authors. Oppositional, compulsive, and protest masculinities. My favorite is protest masculinities. But when men feel subordinated, sometimes they will engage in a hypermasculine performance to basically say, not only am I masculine, I'm more masculine than you. Now, this is an interesting one from the point of view of men's health and risk-taking, and there's a reason why accidents is the number 3 leading cause of death in men. And this is really part of the reason why men also take risks in terms of driving too fast, not wearing safety equipment, engaging in dangerous sports sometimes. It could be sexual risk-taking, such as unsafe sex. It could be engaging in affairs without being careful. It could be things like engaging in aggression and violence in order to assert your authority. And men will often pick resources that they have available to them. So a man who's poor, who doesn't have the ability to demonstrate their masculinity through the expenditure of money, may put more emphasis on physicality. So anyway, I don't want to beleaguer this point because this is just to kind of give you some idea about things. Now, in the realm of the femininities, there are different forms as well, and Raewyn Connell defined emphasized femininity as a form of femininity that's defined around compliance with patriarchal subordination and is oriented to accommodating the desires of men. So this is essentially how a lot of young girls are socialized all the time, is to say, well, do this, don't do that, you know, a nice girl or a good girl doesn't do this, or you know, or if as a woman you've ever been told, like, don't act too smart around men because they don't like that, or don't be too loud because people don't like that, then you've been exposed to emphasized femininity. Now, some people will embrace those ideas, and essentially by doing that, they're perpetuating power imbalance. The second type, hegemonic femininities, is involving the performance of characteristics defined as womanly that establish a legitimate and a hierarchical and complementary relationship to hegemonic masculinities. So this one comes into play in the nursing context or in society in general, where one woman will emphasize certain qualities of being a woman, or for that matter, being a nurse, which basically perpetuates patriarchal structures and power relationships. So, for example, if a nursing instructor or a nurse in the hospital tells a new nurse, you know, you shouldn't speak up, like you don't have a right to speak right now, or if you get slapped down by an instructor for a question, or treated with disrespect, that would be an enactment of hegemonic femininities. It's basically saying, like, you can't challenge me. You can't challenge these power structures. Now, women who engage in actions that are basically aligned with hegemonic masculinities, or in opposition to gender hegemony in general, this is viewed as creating problems for the patriarchal structures. It contaminates the relationship between masculinity and femininity. And so they will often get labeled with negative words. So the lesbian, for somebody who is sexually attracted to women. The slut. Now, slut shaming is a really interesting one because it's very pervasive. This idea that if somebody is, you know, has sex with somebody outside of marriage, or somebody has sex with multiple people at different times, or doesn't have a consistent relationship, then somehow that is their label as slut. So women who are slut shaming other women are engaging in hegemonic femininity. Women who are assertive or not compliant may be labeled things like a shrew or a bitch or a tease. And this also has relevance for nursing, because if you're assertive as a nurse, you need to be. As a professional, you need to be assertive. And unfortunately, women will sometimes get labeled with these terms like bitch because they won't be subordinate. They won't be quiet. Now, essentially, when I'm talking about gender, it's kind of an ongoing challenge because it's complex. And so I often say discussing gender is like nailing Jello to the wall. And in some ways, this has some truth, and nailing Jello to the wall is not easy. But here's the thing, it can be potentially nailed to the wall, as the picture illustrates, if it's mixed, thick enough. But even in that context, eventually it will rip down. And so when we try and organize things into categories and describe things very clearly, which science likes to do, it might hold up for a little while in a certain context, but it doesn't apply to all cases. It's always changing. And so, and even if we're talking about the same person at different points in time, it will change. So I like to use an analogy of water now, because gender is fluid. It's shifting all the time, even within a certain individual. And it takes on the shape and the color of the containers in which we put it in. So if we create a container that says masculinity is this way and femininity is that way, then it tends to look that way, but it's not necessarily what it is. The other thing is that, if you freeze water in time, much like we try and do in science all the time when we might interview somebody or watch someone's behavior at a given point in time, it will form a snowflake or a very clear crystallized pattern, which can be described in great detail. However, just like gender, this isn't permanent because it can melt, it can return to a fluid state, and it can refreeze in another form. And so I find that a lot of people find this water analogy to be a really useful one. So now I've done a background in gender studies, I want to sort of delve into how this is relevant for nursing. So, a question for you guys to think about. In your opinion, how have gender, traditional ideas of femininity, and social power dynamics influenced the development and culture of nursing? If you're watching this as a video in a class, you could certainly pause the video right now if you wish to and have that discussion. I'm going to just sort of say that there's a lot of things that have influenced it, and I'm going to sort of go through some of these things right now. So historically, the modern understanding of nursing kind of came out of the context of Victorian England. And I think that it's really important to keep in mind that Florence Nightingale was a woman of her time. In fact, she was definitely, could be considered a pioneering feminist. But what she was basically doing is just that she was engaging in strategic essentialism to try and advance the cause of women at that point in time. She drew on society's understanding of what society believed women were and what they were capable of in order to make a case for women to be part of, to engage in the profession of nursing. So she drew on the idea that caregiving and physical caregiving and intimate care in particular were assigned to the feminine in patriarchal society, and that women had fulfilled the role of caregiver for a long time. The trouble was with her position was that in the establishment of nursing as a profession for women, she contributed to the reinforcement of essentialized traditional feminine traits. She's positioned traits like nurturance, gentleness, empathy, compassion, tenderness, and unselfishness as essentially feminine and ideal for nursing. And certainly we don't have to go very far to see some of these things being emphasized in terms of how people feel nurses should be. And we certainly see a lot of stereotypical things being posted online as well, around these ideas about, nurses as angels and all these kind of things. Now, this this meant that some of the traits which were socially allocated to women in the Victorian context became entrenched as idealized qualities in nursing culture. Now, this created a lot of problems for men in nursing, I can tell you, and certainly if you're interested in learning about that, you can go to my website, gapsinhealth.com, GAPSIN health.com, no spaces, and then look under men in nursing research, and I have a video there about that. But it also meant that nursing has tended to take a rather subordinate position in relation to medicine and in relation to the way it interacts with government and operates in society in general. Now, this, of course, was reinforced by the fact that at the time when nursing was created, and really for a very long time afterwards, medicine was very much dominated with the patriarchal assumption that doctors should be men. And even though we have more women going to medical programs than men at this point in time, we're still seeing some of those qualities that are associated with doctors being reinforced that have been essentially related to hegemonic masculinities. And as much as we've seen some men entering the nursing profession, we still see that pretty much around the world men occupy 10% or less of nursing positions, and they're still dominant, and it hasn't been shifting very quickly. It's only shifted a few percent over many, many decades. So this is a pervasive issue. Now, Audre Lorde, who is a feminist theorist, wrote in her book Sister Outsider that the true focus of revolutionary change is never merely the oppressive situations which we seek to escape, but that piece of the oppressor which is planted deep within each of us. And I think what Audre Lorde is getting at is that when we've undergone oppression, when we've been socialized into being in an oppressed role or to feel subordinate, we start internalizing those opinions of ourselves. So we start to feel that we are less. And think about how many times you hear nurses say things like, "I'm just a nurse." When someone asks you, "Are you the doctor?" and they say, "No, I'm just a nurse." What do you mean you're just a nurse? There's nothing just about being a nurse. It's a valued profession. It's very important. We consistently are viewed as the most trusted profession in society. And we do really important things. And medicine and nursing do different roles, and they each have their value, just like occupational therapy has its own value, and respiratory therapy has its own value, and everything. And so we're all needed. So there's been some scholarship in the area of gender and nursing that's been discussed really, particularly since the 1980s, where Roberts suggested that nursing could be considered an oppressed group. And this concept is helpful in understanding the behavior of nurses. Now, why nursing could be considered an oppressed group is, number one, the majority of nurses in the last few decades, and since the inception of nursing, according to Nightingale, has essentially been women. And women in society, patriarchal society, have experienced oppression and socialization that reinforces that oppression. Now, nursing and the education of nurses was also controlled by physicians in the early days and as of the late 19th century. And medicine still influences nursing a great deal due to things like doctor's orders and the medical association resisting expansion of nursing scope of practice and things like that. So again, nursing often feels that it's less than or is beholden to medicine or for approval, and so they start taking on oppressed group behaviors. Now, oppressed groups are interesting because they operate in very much the same way no matter what the context is. The tendency is for the subordinate group, as well as the oppressors, to internalize the norms that perpetuate the oppression. So in other words, the oppressors think, well, this is the natural order thing, we're supposed to be in charge. And the subordinate group also starts to say, oh, well, we're justifiably lower than, and if we want to be more powerful, we need to take on the qualities of the oppressor in order to gain power and control. But those people who take on the qualities of the oppressor, but who are easily identified as not being a member of that dominant group, will often be viewed as marginal or not accepted by the group. So this is where gender comes into play here. So if, as a nurse, you start being assertive, if you start speaking up and expecting the respect that is often accorded to dominant groups like physicians without any thought, you may then be viewed as uppity by other nurses, as somebody who is cocky or arrogant. And so the oppressed people start oppressing each other. And so this is what leads to horizontal violence. So does any of this sound familiar to your experience in nursing? And I would hazard a guess that you're going to say yes, because we see a lot of nurses oppressing other nurses and tearing each other down, and unfortunately too much horizontal violence in the profession. Now, as we internalize the social norms established by oppressors and attempts to become marginal, contribute to the development of self-hatred and low self-esteem. So as we internalize oppression, we start to think, oh, we're not as good, we're not worth as much, and we start to get self-hatred. And it develops if the dominant culture doesn't value the characteristics of the subordinate group. So when nurses say things like, I'm just a nurse, they're basically demonstrating self-hatred. They're saying, oh, we're not as important. And if as nurses we devalue the opinions of our colleagues in relation to medicine or any other group, we are also going to perpetuate some of those things. The other thing that happens is something called submissive aggressive syndrome, or passive aggressive behaviors. The oppressed people feel that they're not able to express this aggression towards the oppressors, although they feel aggression. So this approach is ineffective, which leads to frustration and failure and further low self-esteem. And then their aggression is often frequently vented in a self-destructive way by turning this aggression on other members of the oppressed group through horizontal violence and intergroup conflict. And unfortunately, this just provides evidence to the oppressors that the oppressed group is unable to organize or govern themselves. So think about what you've learned about nursing and how nurses talk about one another. There have been lots of occasions where nurses from one area talk down about nurses in another area. The hospital nurses tend to think that they're better than the community nurses. Community nurses think they're better than the hospital nurses. The ICU nurses think they're better than most of the nurses in the hospital. The ER nurses also think they're better than the floor nurses. Floor nurses might think they're better than some other group of nurses. So it's just kind of an ongoing cycle. And the more we fragment as a profession and as a group, the easier we are to continue to keep at bay, because those in power go, those nurses can't get themselves organized. They can't stay on the same page. They spend all the time attacking one another. The other problem is although oppressed groups want to be authentic, they fear it and ultimately become agents of their own oppression because they have internalized the consciousness of the oppressors. So in other words, they think, well, I'd like to do this, but we're probably not good enough to do it, so we're not even going to try. And you can see how this is self-destructive to the progression of nursing and to our own development as professionals. So it's not uncommon for nurses to suggest that if they could only attain the characteristics of the powerful or be truly acknowledged for their professional status, that they too would be powerful. But there's ultimately some fallacy in this statement, because the issue is not about being recognized by other people as powerful. It's about recognizing that you have power. We all have power. We have to just choose whether we're going to enact it or not, and how we're going to use it. Nurses frequently think of themselves as second-class citizens when compared to medicine. They demonstrate low self-esteem. And nurses, like other oppressed groups, exhibit signs of self-hatred and dislike for other nurses. And this is evident in the lack of cohesiveness observed in nursing groups and the degree of horizontal violence documented in the profession. So when you hear terms like nurses eat their young, this is a good example of this kind of horizontal violence enacted on each other. Nurses also demonstrate another characteristic of oppressed groups, which is fear of success. They can be fearful because they lack belief in the existence of alternatives to the status quo. So they don't really think that it's possible for them to be successful or to occupy a different social location. And the submissive aggressive syndrome is pervasive between nurses and in interaction with groups like physicians. But it also can be enacted as nurses who are oppressed engage in acts with patients and family members where they try and exert power because they feel disempowered in other ways. So they abuse power in the context of other people, and that is counterproductive to us being successful in what we do. It's not what we're supposed to do as nurses. We're supposed to be patient-centered. We're not there to tear people down. We're there to support people and facilitate health. Reinforcement of gender power is also maintained through performances of hegemonic masculinities, hegemonic femininities, or emphasized femininities, and the labeling of those who do not maintain the status quo. So what about a new nurse who is assertive and gets put down by women who think that they're being too arrogant, that to be assertive is not appropriate for them, they haven't earned that right? Or men who are enacting the idea that they are more important because they're men and they need to be treated differently because of that. So I've sort of talked about a few of these examples as we've gone along. Marginalized masculinities. So men who maybe are engaging even in nursing may be marginalized by nature of the fact they're engaging in caregiving. And so sometimes the statements that are made about men are negative. And although I'm sure that most of you as nursing students have been asked, why didn't you choose medicine, I can assure you that the men have been asked it even more. Because there's always an assumption that as a man you should have gone into medicine if you're intelligent. And so and men often struggle with a lot of generalizations that are made towards men in nursing, like the assumption that they're gay because they're nurses, because the association of being involved in caregiving associates men with the realm of the feminine, and then they extrapolate that falsely to the idea that somehow because you're feminine then you must be gay. Now obviously there's nothing wrong with someone being gay, but I'm bringing this up really because of the issue of power being enacted and how men are being policed by hegemonic masculinities in that context. So we can break this cycle. nurses don't have to keep eating their young. And we each have a role to play in changing this. Because even though you might be in first or second year nursing when you're watching this, you will still have the opportunity to support other nurses, and they'll be, but if you're in first year, before long you'll be in second year, and have first year nurses students around you, and you can be supportive and not enact these power hierarchies on each other. So how can we rewrite this script? Now, if you have time, you can certainly, if you're watching this in a class setting, you can pause the video and think about this and have a discussion if you wish. If not, I will continue to go on and talk about how I think we can rewrite the script. So what are some ways in which healthcare organizations can loosen the grip of harmful gender scripts on nursing? What can you as an individual nurse do to change your professional reality and the reality of those around you? So just think about those questions. So how can we overcome oppression? Well, one of the first steps to addressing oppression is to recognize that it's present and to start seeing it in the actions and in the words we use, and we need to unveil the world of gender oppression through education and discussion. So this presentation I'm doing at the moment is certainly one example of that. But you will have other conversations throughout your nursing education, and also hopefully in your practice world as well, where you can start learning more about this and thinking about what's going on. We also can start expulsion of the myths created and developed by the old order. So reject the negative images of one's own culture and replace them with pride and a sense of ability to function autonomously. So in the context of nursing, this means that we do need to start being proud of what nurses do and stop positioning it as less than. Now that doesn't mean that we should celebrate everything as if it's perfect, because there are certainly opportunities for us to improve the way that we practice as nurses at any given time. And there are certainly lots of areas where there are some practices that need to be addressed and improved. But we need to change the language we're using. We need to start talking about nursing in a different way and positioning nursing in a different way and expecting to be treated differently. And we teach people how to treat us, and how we interact with them is going to influence how they interact with us. Now, Freire, who's a Brazilian educational theorist that I've quoted liberally throughout these slides, said that freedom cannot and will not be granted by the oppressor. Freedom can only be acquired by conquest, not gift. So if as nurses we are going to wait around for someone to give us power, it's not going to happen. We have to choose to recognize our inherent power and enact it, and claim that power and occupy space, and be strong as professionals. So how can we break the pattern? Well, I think nurses have to be consulted, including in decision-making processes that affect them in their practice. And sometimes this means that we're going to have to insist that we're at the table. I think that too often nursing is not at the table when they should be, or that they're not given as much importance to their voice. And I think sometimes we've also allowed that to happen because we think somehow that our voice isn't as important. We need to change that. Something that we can do every day as nurses is we must treat each other and other professional groups with mutual respect. So start changing the way we talk about one another. Start treating each other with a professionalism and a respect, And this can start in your classrooms. Rather than tearing someone down, always recognize that people are trying to do their best, and that we're going to celebrate the good things about them rather than focus on the negative things that we view. We're going to try to recognize that it's okay for people to be assertive and to speak up. It's okay for people to ask questions. There's nothing wrong with that. It's a good thing. We need to not make fun of somebody who asks questions. In fact, their practice is going to be safer, because they are willing to ask questions if they don't know. This muzzling of ourselves is not going to help anything. It's not going to help us learn, and it's not going to make us get better. We need to raise awareness of gender scripts and oppressive group behaviors through education, which this is one of the reasons why I'm going through these ideas with you today. We need to facilitate the development of caring nursing communities. So what I mean by that is caring is not necessarily telling people they're wonderful if they're not, or if their practice isn't good. Because caring is also about being honest. It's about telling people, all right, this is strong in your practice, this is areas where you could improve, but doing so in a way that is constructive and with a positive end rather than taking a negative approach. We need to engage in mentorship, increase support and self-esteem, and take on an increased sense of agency and power. So even as nursing students, you can be a mentor to other nursing students. You can support one another. You can encourage people who want to go into nursing. You can spend time helping people who are not as far along in their education, or somebody who hasn't had the experience that you've had. So maybe you had an opportunity to do a certain skill and another person hasn't. Support them. Mentorship is very near and dear to me, and it's something which I try and practice all the time. When I was a nursing student, I had the privilege of being mentored by numerous people, and it made a huge difference in the nurse I am today, and throughout my career I continue to be mentored. I personally make an effort to mentor people all the time, and not just the people who are in my classes. I mentor people who've left nursing school who I've had contact with. I have people contacting me all the time for advice or for some encouraging words, or sometimes for my opinion or other things. And I literally mentor hundreds of people, which sounds like a lot of work, but it's actually not that bad most of the time, because people only need help every once in a while. And there are people who serve that role for me as well. We need to identify disempowering discourses and practices amongst nurses and work to eliminate them. So we need to address the language we're using, and we need to change the script that's being used. We definitely need to develop programs to challenge the root causes of horizontal violence or bullying and facilitate practice shifts in communities of practice. Now, what I mean by this is we have to recognize the gendered and power roots of this, and we need to address those in order to address the bullying. Getting together in a room and sharing experiences of bullying towards us is not going to make things better. We have to reclaim that power, and we have to create a climate in which we do not tolerate that behavior in nursing. We have to create coalitions of the willing in workplaces to change the channel at the grassroots level. So maybe not everybody's going to buy in right away, but those people who are positive are going to attract other people who are positive. And gradually, more and more people will join that movement. And so we can change the pattern of things, and eventually those people who are negative and destructive, they'll either retire or go away, because it won't be popular to be in the space that they're in. We also have to sit at the table because we deserve to be there. And we have something valuable to contribute. I have been teaching for 15 years at this point, and I can tell you one of the conversations I have with students all the time, even graduate students, is that you're intelligent, you have something to contribute. your voice matters. Speak up, use it, and try and be present and give your opinion. You need to sit at the table. So if you go to a meeting, don't sit on the periphery of the room. Sit in the center of the room. Be in the middle of it and contribute where you can. I know it's scary initially, but eventually, as you share your opinions, people will give you some positive feedback for that, and you'll start realizing that your voice is valued. So think about all of these things. Lead by example. Develop your nursing practice into what you would like it to be, and then you'll begin to gain support from others as they see you and the fresh perspective you bring to your work. And so with that, I'd like to just say thank you, and I hope you found this discussion interesting. There's certainly lots more interesting stuff to read if you desire. Talk to you later.